I think I was like asking for change. At the same time, I think when opportunity showed, when there were opportunities, I made sure that these individual members, these individual patients could meet some researchers, so they could talk for themselves, make a room for themselves. And I think slowly, this idea of we give information and we receive another kind of information and this is improving our project, but the project never changed. Slowly in the head of the researchers, this changed, and it was we need to create more partnerships. But it happened. I don't know how it happened. It's really difficult for me to say what exactly. I think it's a whole social process, and it's like research is also a social and cultural phenomenon, and I'm still working on this. But I think it's totally an outcome of working on with our little group of patients. They radiated something beyond their little discussions, and it's just not the content of the discussion; it's the medium. The way that discussions were organized and everything, it caught people's interest, and they wanted to know more. They wanted to know more about what patients think, so they changed the way they do research to include more perspective of patients and be more interested in that. And they were willing to collaborate as well. So when there were some individual members that could be grabbed and brought into the research team as collaborators and as partners, they were also willing to do that. So there definitely this open-mindedness on the part of researchers that was that made a big difference. Mm-hmm. And not only within our little research team, I think in the broader institution, in the circle where we work, the kind of researchers from the service for people living with HIV, they were willing to do that. And they were ready to do that. I think there were some also. Some had already started collaborating with community organizations. There was already a culture established around that, but patient engagement gave them, I don't know, new tools to work more directly with different people, different stakeholders. So they enjoyed that.
Yeah. Interesting.